Hi, I'm Angela with Speech Therapy, and today I want to discuss how to give a nursing dysphagia screening. First thing that we're going to do is assess our patient. We are going to make sure that they have their head of bed elevated close to a 45-degree angle. Sometimes we do need to put a pillow behind their head for proper positioning to make sure that they are not in a more reclined position to get them appropriate for PO intake. We will then look to make sure that their GCS score is at a 13. And then next we're going to assess the patient for weakness. The first one we're going to look at is for facial weakness. So we will look at the patient's face and typically the corners of the mouth to see if there's any sort of facial droop that would let us know and alert us that there is a facial weakness. The next thing that I would have the patient do is open their mouth and stick their tongue out. And I'm going to be looking for symmetric protrusion of the tongue. If the tongue deviates to one side or the other, that would let me know that they have tongue weakness. The next one I'm going to look at is palatal weakness. So for that one, I would have the patient open their mouth and say ah,
Ah,
and then ah again,
ah,
and one more time.
ah.
And what I'm looking for is any sort of asymmetry of the back of the mouth of the palate. And when we do that ah, we will see the palate elevate, and if there's weakness, one side would elevate not as much or not at all. So if a patient has a yes on any of those, then they fail their nursing dysphagia screen, and at that point then they would participate in the speech therapy bedside swallowing evaluation that's part of the order set. So at this point, if they pass those 4 criteria, we would go ahead and proceed with PO intake. And the first thing that we're going to do is get a cup of water. And for this, we're going to start with our first spoonful of water, just a teaspoon of water. So we would present it to the patient and have them swallow. And at that point, if we notice any signs or symptoms of aspiration, we would stop. Those would include coughing, choking, really a wet, gurgly vocal quality, or a significant amount of throat clearing. At that point, if they present with any of those symptoms, we would stop the test and they would participate in the speech bedside swallowing eval. If they do not present with a sign of aspiration, then we would go ahead and give our second teaspoon trial. Okay, again, no aspiration there. And so then we would present with a third teaspoon trial. Fine there again. And if any of those 3, they cough or choke or have any signs of aspiration, then we would discontinue the test. But she did fine, she passed those 3. So the next thing that I'm going to give her is the cup of water, and I'm going to ask her to finish the cup of water just in a consecutive swallowing pattern. So tilt the cup back and she would just drink it. So here, if the patient is unable to consecutively drink the water without signs or symptoms of aspiration, then they would pass. If they did have signs or symptoms of aspiration, we would have them do the speech therapy dysphagia screening, or dysphagia evaluation rather. So then at that point, if they passed, we can discontinue the speech bedside swallowing evaluation in the order set, and we can place the patient on a general consistency diet. Some of those we'd have to ask the provider to make sure that that diet was okay for that patient, but we would not need to include speech therapy at that time.